A little technical difficulties. Operator error. How has your week been?
Not bad.
Nothing for Jades of our lives?
I don't think so. Oh, no, is there something? I'll probably remember at some point.
So
Because
nothing too crazy.
my life's never just mellow. It's just the
Mellow.
level of craziness that changes. So I'll casually be like, oh, so this happened the other day. And people are like, what the fuck?
Yeah.
And it's just Tuesday.
Well, I had a full meltdown at work and cried.
Oh, no.
Which brings us to today's episode. No, literally it does.
Yeah,
Because if I did that back in the 30s, I probably would have gotten lobotomized.
Oh, yeah. I think there's lots of things that specifically women do these days that would have got us. I absolutely would have been lobotomized.
Yes.
And they would have kept going back until I was drooling on myself. They would have been like, you know what? She needs another one.
So that's, I guess that's kind of a segue into today's episode.
That's it. We can sit back and peel back the scalp. I was like, I've got to drop that in there somewhere. And I'm sure I'm going to make like heaps of puns about brain surgery.
Oh, please do. I love puns. Because we're not making fun of anyone. This isn't...
That's it. This is another one of those stories where, as fucked as it is, it had to happen for medicine to get where it is now.
Yeah, that's very true, actually.
Like, yeah, it's... Which a lot of that stuff is, like, you hear about tragic medical things and they kind of needed to happen. So...
In a way, someone had to have been a guinea pig.
That's it.
Yeah.
And, like, you almost have to know what not to do as much as what to do.
Yeah.
So it's just a pity that they practice on people.
Yeah. So. Yes. But we're here today.
We are. Unlobotomized.
Unlobotomized. Also, what the fuck? Sorry.
That's my cup.
There's a full beach scene in her lid. I don't know.
It's a Lilo and Stitch cup.
It looks like a snow globe.
Yeah. As I was driving here, I was giggling to myself because I was like, oh yeah, Miss fucking heavy metal, black gothic everything.
I think that's why I was so shocked as well.
And I rock up with a cute Lilo and Stitch cup and a fucking Labubu.
That is so cute though. That was a massive side quest.
Right?
Sorry.
We're like, let's get into it quickly. Here's the episode. 25 minutes later.
Oh, shit.
All right. So, the lobotomy. It's something that comes across as, well, not comes across, it was well and truly one of the darkest eras of medical history, as well as like with last week's episode as well. There were dark times that were started with good intentions. I mean, I don't know how good Mengelé's intentions were, but this ended up being something very, very tragic, but it came from a good place. They were trying to help. They just didn't very much.
I'm actually really excited because I just remembered last episode you said some celebrities paid to get their kids lobotomized.
Yeah.
So
I'm going to get to hear about that today.
Such a nosy biatch that I want to know who.
So when you said before that you'd looked into it, I was like, oh my God, I hope you didn't find out who it was.
Nah, I didn't look too far into it.
Oh, very good. Very, very good. So today we have a story of ambition, science, and silence, of doctors playing God, ice picks through eye sockets, and one silent woman, the sister of a future US president, whose life was forever changed by a single brutal procedure. So sit tight. This isn't brain surgery. Oh wait, it kind of is.
Kind of, yeah.
That was so funny when I wrote it. It sounds so wanky now.
No, that was brilliant.
So I was trying to be all like suspenseful in my talking. But buckle up. It's just brain surgery.
I loved it.
So the word lobotomy comes from the Greek lobos, meaning lobe, and tome, meaning cutting. So it literally means cutting of the lobe. More specifically, it's a form of psychosurgery that involves severing connections in the brain's prefrontal cortex because it was believed to calm the mentally ill by cutting off parts of the brain that controlled emotion and behavior. So I very, very guaranteed would have been lobotomized.
Mm-hmm.
So spoiler alert, it did calm them, often permanently and sometimes fatally. So in 1935, neuropsychologist John Farquhar Fulton presented some information at a medical conference regarding testing in chimps. He explained how by removing the frontal lobe in chimps, they no longer experience frustration or anxiety. Fuck, wouldn't that be nice? Maybe I want to be lobotomized.
Oh no, I was just thinking maybe this sounds like a nice vacation.
He boasted that it seemed like the chimps could now only feel happiness, and he made the joke that it was as if they had joined a happiness cult. He did admit that the surgery had cost the chimps some cognitive function, but to an eagerly listening Egas Moniz, this seemed like a small sacrifice to make in the search for a resolution to mental illness and melancholia. It was with pure good intention that Egas would adopt the procedure and adapt it towards treating humans. The technique rose to fame and infamy in the 1930s and 40s, when mental health care was somewhat experimental and definitely less than ethical. Although the origins of the lobotomy lie with the Portuguese neurologist Antonio Egas Moniz, it would be an American man who would take the procedure worldwide. So Moniz's idea was that mental illness and invisible pain were problems of faulty brain circuits, and if you could cut those circuits, you could cure the illness. So you can see where his thought pattern was. Like, it does make sense.
Can I just ask, though, when was anesthesia brought in? Because would they have been like...
might have been around now, but it wasn't used. So starting in 1935, he began the experimental procedure where, without anesthesia,
my bad,
he would drill holes into patients' skulls and insert a rod to cut the connective white matter between the thalamus from the front hold on.
There's some big terms in there.
I had a fucking stroke. No, I've missed a word in this sentence somewhere. So starting in 1935, he began an experimental procedure usually performed without anesthesia. This was called the leucotomy. He would drill holes into a patient's skull and insert a rod to cut the connective white matter between the thalamus and the frontal lobe, completely severing the prefrontal cortex from the rest of the brain. It was also said that he injected pure alcohol into their brains to destroy tissue during the procedure.
Alcohol straight into the brain.
Yep. So it sounds pretty freaking medieval, really.
That almost sounds like a torture technique.
Right? That's crazy. So Moniz performed this procedure on 38 patients, people who were brought to him with hallucinations, rage, irritability, anxiety, and after receiving the procedure, they would be calm, sedate, and passive. So it would appear that the surgeries were successful. His peers agreed and celebrated his achievements.
Can you imagine how many people would have been lobotomized in nowadays? Almost like 99% of people have anxiety of some kind.
Yep. The things that they would lobotomize people for, like, spoiler alert, but it ended up becoming a money grab.
Yeah.
So I could be like, Annetta was sassy yesterday, can you lobotomize her? And they'll be like, okay. It was as simple as, you could walk up there and say, I've been in a foul mood for the last week and I don't know why.
Oh, you need to get lobotomized.
Let's lobotomize you about it.
But
yeah.
Then would they use anesthesia, or would that still be no-no?
No.
Oh, why would you want to not do anesthesia?
So what the medical peers of Dr. Moniz paid no attention to was that patients would experience the loss of senses. They would lose their smell, their sight, they'd get infections in the drill site, spinal fluid leaks, and in some cases their symptoms would become worse, resulting in psychotic rages or almost catatonic states. But somehow the few cases in which it worked outshone the many, many cases where it didn't. Despite a massive failure rate, Moniz won the Nobel Prize in 1949 for this procedure after being nominated by Dr. Walter Freeman, an American lobotomy enthusiast. So this leads us to Dr. Walter Freeman, ice pick evangelist. Ba, ba, ba.
That's the picture we found on Google. Not obviously a real picture. It was like a drawn picture. Yeah, that was the ice pick one. I was going to say, Google the ice pick lobotomy.
Yeah.
Because the visual of that and where they insert it.
Did you watch the video?
No. I didn't realise that was a video.
Oh.
Mind you, we were on the work computer. So that probably was blocked.
So Freeman wasn't a surgeon. He was a neurologist with charisma, a flair for showmanship, and a deeply unsettling obsession with making the leucectomy quicker and easier. The faster they could be done, the more you could do. Improving his procedure was always on his mind, and one day, while reaching for a fork, he noticed an ice pick in his kitchen drawer. Enter his very own invention, the transorbital lobotomy.
Wow.
This was done by hammering a long, sharp object, quite often literally an ice pick, through the eye socket, behind the eye into the brain. Then it was swiveled to cut connection in the frontal lobe. The whole thing took approximately 10 minutes. No need for an operating room. No need for anesthesia. Just a little bit of electroshock to knock the patient out. So Freeman lobotomized over 3,500 people. He performed demonstrations at medical conferences. He traveled the country in his lobotomobile. He was a rock star of psychosurgery. Yep. He's not even a surgeon, and he was teaching doctors how to do this procedure.
I'm literally speechless.
Yep.
Driving around in his lobotomy vehicle.
Yep. And it was literally like the advertising for it was like, you know, when you see on old movies and stuff when they're like, they rock up in their little cart and they're like, try this hair tonic. It's made of camel piss and lemon juice, and you rub it on your hair and you'll have hair for days. That's how it was advertised.
Wow.
It was like, quick, join in the lobotomy. It was
like a fad.
Yep. You know, like how they're advertising like Ozempic and stuff these days, how they're like, oh, this could work for you. It's made for something else, but
like
it could
medically
work
tested.
For
like,
yeah. It was like, come on, come on, step right up for a lobotomy.
Like a circus freak show.
Right? It's the greatest craze in the 1930s. Forget about the war, get lobotomized. Like,
got too many emotions? Get lobotomized.
Wow. It was insane. The 30s and 40s would have been a mental time to live. Do you imagine going back to that now, knowing what we know about life now?
Yeah.
Crazy.
And how we've turned out. And then imagine having to stroll through the streets and being like, Bob.
Yeah. Seeing 6-year-olds with cigarettes. Why are you smoking?
Yeah.
Oh, because I got a rash on my thigh and the doctor said cigarettes will help me. Oh, God.
Those were wild times.
Right.
Like I was there.
So he would perform the surgery in anyone and everyone who didn't fit the normal societal mold. Hysterical housewives, people with what we now know is autism, ADD, bipolar, schizophrenia, postnatal depression, anxiety, general depressive orders, or just general levels of sassiness. So people who didn't fit the restrictive norms of society at the time. So in 30s and 40s, if you weren't your everyday housewife that just nodded and cooked dinner.
No wonder.
Yeah. Your husband could get you lobotomized.
Wow.
Like, and at
you
that
had
time,
no say. Like it was, yeah.
Because at that time, if you were unmarried, your father owned you. If you were married, your husband owned you. So if your father or husband said lobotomize her, they did.
Wow.
Crazy.
Jesus Christ.
It was also quite often performed on spirited children who were hard to get along with.
Imagine how many kids would get lobotomized.
Right? There was a story of a little boy who was 9 years old and he got lobotomized because he didn't get along with his stepmom. So she said, he's hard to get along with. We don't communicate well, so they lobotomized him.
Imagine if we lobotomized criminals.
I could agree with it to an extent. There's some out there that could be lobotomized.
Maybe like full blown, but not, not just stole like a
that's
loaf of bread
like,
from
people like Von Einem or something, like lobotomize them.
Ones
and
that
then,
are literally insane.
Yep, lobotomize them and then do medical testing on them.
Or the ones that plead insanity.
Yeah. Oh, you're crazy.
You insanity,
Here you
go. You get lobotomy.
Yeah, that's it. You get a cushy room for the rest of your life, but you'll be drawing on yourself. Yep. I do like that.
Do you go trademark?
Trademark.
Finally, I got one.
Trademark lobotomy for the insane.
For the ones that plead insanity, yeah. Yes.
Oh, like that woman from Port Pirie.
Oh, I can't believe she got found guilty.
Oh, the mushroom chick.
Is that who you're talking about?
No, I was talking about the one who killed the one from Beauty and the Geek.
Oh,
who, killed her partner and just dumped his head somewhere.
Walking around with his head in her bag on the CCTV footage. Oh my god!
She needs. Maybe she had a lobotomy. Maybe that's why she's like she is. Who knows?
Wow. There's some wild things happening in Australia at the moment.
I saw a meme, totally fucking digressing right now, but I saw a meme before and it was, the video of that guy from like the 80s and he got wrongfully arrested while he was eating Chinese and he's like, I was just enjoying a succulent I saw one before and it was like the cops arresting her and she was yelling out, I just made a succulent mushroom meal.
Yeah, I've seen that one.
Oh, it killed me. Absolutely killed me.
I'm not comparing it to America because America's going through some wild shit right now too. But that's what we've got. They're going through like full-blown riots, and we've got some lady killing family members with a mushroom meal. Wow.
Oh, Jesus.
That might be a good episode.
Yeah, I was thinking that the other day. Yeah. We could share a recipe.
Note to self.
So the procedure quite quickly became a fix-all for anything society deemed not normal, and if you had the money, the procedure would be done. The patient, willing or not, would be strapped to a bed, they would receive electric shock therapy to render them unconscious, and Freeman would then insert the ice pick into their eye socket near the tear duct and use a medical mallet to hit the pick, breaking the thin piece of bone in the orbital socket and severing the thin layer of protective tissue covering the frontal lobe. Despite the numerous failures and horrible side effects, mental health issues were so taboo that people would not speak of the side effects or failures, so people lined up in droves to have themselves or their family members lobotomized. No one wanted to say, hey, my friend was crazy or my child was crazy, so I got him lobotomized, but it went badly. So they were keeping all the horror stories to themselves, and people were only seeing the good stories. Mm-hmm. And like they were posting in the newspaper and everything, like pictures of women all like, you know, disheveled and pimples on their faces and no makeup and wearing pants. And they'd be like, before lobotomy, and then afterwards she's got nice makeup and her hair done.
Bow on the hair.
Yep, and she's wearing a dress. And they'd be like, after lobotomy. It shows the difference, like just in advertising. Yeah, it was a interesting world.
That was like full false advertising.
Yeah.
And nowadays you can't.
Yeah, because it was like, oh, well, she was a woman that wore pants beforehand, and now she's back in dresses like she should be. Good girl.
Good girl.
So the procedure would storm the world with anybody and everybody lining up to have their troublesome family members lobotomized, including American royalty, the Kennedys.
Wow. See, I did not know that.
So, born in 1918, Rosemary Kennedy was the third child of Joseph and Rose Kennedy. From the outside, she was a beautiful, shy girl from a powerful family, but behind closed doors, Rosemary struggled. Rosemary was developmentally delayed, only reaching about the level of a fourth grader. She was prone to violent mood swings and often unable to control her impulses. So, in one of the podcasts I was listening to, her impulses were going out and drinking at a pub with men.
Oh, wow.
Going shopping, going out on her own, driving a car.
Doing things that...
Yeah. Yeah, because she was a Kennedy and she was a Kennedy woman and she was just meant to be pretty.
Wow.
Which she was. She was gorgeous. But yeah, she was a little behind.
They just wanted like the perfect Stepford wife for a Kennedy.
Exactly. Her behaviour became a deep source of concern, especially for her father. In 1941, when she was just 23 years old, Joseph Kennedy made a decision that would shatter her life. He consulted Walter Freeman and authorized a lobotomy without informing his wife Rose. The operation was a disaster. During the procedure, Freeman and his partner instructed Rosemary to recite the Lord's Prayer. When she stopped responding, that was when they knew they'd cut too deep. For the rest of her life, over 60 years, she lived in an institution, never regaining the ability to speak. She was left with the mental capacity of a toddler, and she could no longer speak coherently, walk unaided, or care for herself. She lost complete ability to toilet herself. She was essentially erased from public view, and her siblings were told that she was away at school. She didn't appear at family events. Her existence was a closely guarded secret. He never told father, Joseph, never told his wife or the children where she was. So she spent 60 years in that asylum completely alone.
Wow, that's really sad.
Yep. Only years after the deaths of JFK and RFK did the truth begin to leak out. The fact that poor Rosemary was left alone in the asylum for so long with no visitors became a source of shame for the Kennedy family. Although I think the fact it became public knowledge was where the shame lied. So by the 1950s, lobotomies were being performed in the tens of thousands, and not just in the US but worldwide. Some were on people with severe schizophrenia, others on housewives with anxiety, anxiety, even on children with behavioural issues. But things were changing. In 1954, the first major antipsychotic drug, Thorazine, was introduced, and suddenly there was a non-invasive way to treat mental illness, and lobotomies started to look nothing short of barbaric. Freeman, undeterred, continued his work until 1967, when his last patient, the third time he had lobotomized her, died of a brain hemorrhage. He was banned from performing the surgery ever again, but the damage was already done. The story of the lobotomy is one of hubris, desperation, and misunderstanding of mental illness, of human dignity, and what it means to be cured. Rosemary Kennedy's story is more than just a footnote in history. It's a chilling reminder of what happens when control outweighs compassion. Her family later acknowledged what had happened to her, and her younger sister, Eunice Kennedy Shriver, would go on to found the Special Olympics in her honor. In a strange, tragic way, Rosemary's silent life led to a movement that gave voice and dignity to millions of others with intellectual disabilities. We talk about Rosemary's story because she was a Kennedy, and shock and awe always garners attention. But with over 40,000 lobotomies being performed, there would be countless stories just like hers. So it's insane to think how many people out there had their lives so dramatically changed by a lobotomy, but people wouldn't talk about it because it was shameful, and no one would give a shit because they weren't a Kennedy. So there was a story when I was researching. There was a girl whose mum was lobotomized when she was 3 months old because she had what we now know would have been postnatal depression. But because she wasn't showing motherly instincts, her husband submitted her for a lobotomy. She forgot how to walk, talk, go to the toilet, everything.
So he just made it so much worse for himself.
Yep. So her sister then moved into the home to help look after her.
Mm-hmm.
But she was that reliant on needing help that the sister couldn't look after her and the children. So the children ended up in orphanages.
Oh my God.
So even though they had a mother, father, and an aunt living in the house,
they just couldn't do it all.
Yep.
Yeah.
The kids ended up in an orphanage and grew up in an orphanage because she was nothing. She was a living, breathing sack of nothing. And there were so many stories like that where it was just, and predominantly women, mostly women that copped it because I guess they had a man who owned them at the time and would
say they're crazy. So they would just listen to him over her. Even if she spoke probably the most fluently you'd ever heard, they would still believe the male over the female.
That's it. And they probably would have gone, oh, well, now we can add manipulation to her list of things. She's manipulative. She's coercive.
Yep.
Mm-hmm. Yep. They would have added all these other things to her list. But how crazy to know that in 1935 they were having issues and it continued for 30 years.
1967. Yep. Like, to me feels not recent, but that's not that long ago.
Yep. And the first place in Australia to actually do lobotomies was Z Ward.
Really?
Oh, wow. Z Ward in Adelaide. So they were, again, product of the time. But if you were in an asylum and your family just walked away, you became property of the government.
So they just use you as a
test. So you didn't get to consent. Your family didn't get to consent. They were like, oh, this could work. Let's do it.
Mm-hmm.
Because at the very least, they were coming out of it with people they could control because they'd just sit in their room and drool on themselves.
They weren't aggressive. They weren't fighting back or causing trouble. They were just docile, and
that's it. And I did come across some cases that did work. There was one woman they were saying prior to her lobotomy, she couldn't even look up at people in the room. Her head was always down. She would always be fidgeting with her fingers. If there was loud noises, she'd put her hands over her ears and scream. So very clearly autistic, and they lobotomized her, and she came out of it with, she could lift her head and she could talk and she was happy, but sort of went from one extreme to the other. She didn't ever experience sadness and feeling down and pain. So if she hurt herself, she didn't know that she was in pain, but that was classed as a success.
Yeah. It's interesting looking at those medical records, what you would find and what they noted and what was an important factor in things.
It would be so amazing to get the files and be able to read through to see how much they changed.
Yeah.
And I wanted to see, I tried looking for it and I couldn't find it, but I wanted to see anyone who was put in an asylum, had the procedure, and then was deemed sane and released.
Yeah.
Because it quickly went from being used in asylums and stuff like that to just being used on everybody.
To how quickly they trusted that procedure.
Yeah.
like how many guinea pigs were there before that came out and was advertised?
There was a
public?
12-day stint where he did 260 lobotomies in 12 days.
That's a lot.
Yep.
That's a lot.
And they would have people like in a big open room, so there'd be like 5 beds, and he would go along, chip, go to the next one, chip, and just clock them out and then
so then I'd get like knocked out by the shock therapy, and then
and he'd just break the seal and then go on to the next one, as if like a nurse walking through doing rounds and
just checking your chart.
Here's your meds, go to the next one. And he would brag about how he could do it in 10 minutes. There was videos of him doing people in the chair, like just sitting in a casual chair, where he would have his knee up on their chest to get the oomph to crack the bone.
That is unbelievable.
Yeah. And people were standing around just in awe, like watching it all. I found there's a video on YouTube of the procedure, and it's a silent movie because it's that old. Like the whole thing, there's no
I wonder if
sound
there's
or anything.
ever been like a reaction as soon as it's happened with the body, like whether anything's spasmed or whether it's made anyone have a seizure or anything like that. I feel like learning psychology would be so interesting, just to know how the brain works.
Yeah. But watching like some of the videos on YouTube and stuff where they do like cartoons of how it would happen, and when they were originally started by that Dr. Moniz, he would go through and basically cut around a whole section of the brain to separate lobes of the brain so they wouldn't be attached anymore.
So would he cut like a huge chunk of your skull?
Yeah, so he would go in through the side and drill a hole and then go in there with his tools and then just cut through that section of the brain.
Hole.
Yep.
With no anesthesia.
Yep.
I just almost kicked my neck out now.
And like, you think too, that was done in a time where like nowadays they do brain surgery with cameras and microscopic tools. There was none of that. It was just a feel around, oh yeah, this feels like the right part, let's cut here.
Oh, that is like, I'm actual speechless with lobotomies.
It was definitely interesting. I also found out, like, when I was doing this, they still do electroshock.
Yeah.
Like, I thought that was ruled out. And then one of my friends, her mum has dementia, and they're treating her dementia with electroshock therapy.
Oh.
They take her down to the hospital once a month or something, and she has electroshock therapy.
So when they do electroshock, is that where they literally just zap?
Yeah, the nodes on your temples and zap it. And there's also I went down a whole rabbit hole with like mental health treatment with this. There's a thing now, it's like a pacemaker, but it's for your brain. And it still sits in your chest, but the wire goes up into the frontal like cortex of your brain, and every now and again it'll just zap you and send you a little electric shock,
like kind of reboot your brain. Oh my god. Imagine the surgery for that to like get that up there.
And apparently that's having massively good results with anxiety and depression and like severe mental health, not like, half spastic people like me that can just take a tablet and function.
You're right, yeah.
But like for full real psychotic, debilitating cases, and they want to start using it on bipolar and all that sort of stuff, so that if you're having a down episode, they can zap you and snap you out of it.
Does it hurt?
I don't know. I didn't see anyone say anything about it, because I don't think you would have, like, a lot of your organs, you don't really have feeling in them, and the pain that you get is from the inflammation around them. So I would assume your brain would be the same. I wonder if it's like a brain freeze type, because you know how when the brain freeze comes, it just comes real quick and just hits. I wonder if it's like that
and reboots you.
But
it's funny to look at, like, people doing things like microneedling, and people in probably 20, 30, 40 years might look at that and be like, why the hell would you put a needle all over your face? What benefit could that possibly have? And look at us and think we're crazy.
That's it.
That's semi-painful-ish, but people go through it because...
And like when they do that thing with the threads in your face, like when they do that like internal facelift, where they do, have you seen that? We look at that now and we go, oh, that's amazing. And in 40 years, they could be like, that's fucking barbaric. So at the time, there would have been a lot of people that, if you were dealing with someone who was schizophrenic and unmedicated, because there was no medication for it, the thought of trying this would have been so enticing
Yeah.
You'd be like, well, they can't
like,
get any worse.
Yeah, it can't get any worse than that, yeah.
That's it. And they, they can't work, they can't do this, they can't do that. So if they come out of it better, it's worth the risk.
And I think that's kind of why they probably used a lot of patients like that as guinea pigs, because they were either there, left, didn't have family. So it was kind of, not that no one would miss them, but it was kind of, they had that
there was no
to,
there was no repercussions because there was no one around to
be like,
say
well,
anything.
You fucked up my family.
That's it. Like, they've already given up on them and forgotten about them and
left there. I'm not saying it was like an okay thing to do, but
you can definitely understand why, as uncouth as it was, you can understand why they would have done it. Like, these people are abandoned by society, But then everyone cracked the shits about that, and then they started doing these tests on animals. Now they're cracking shits about that. Why don't they just do it on pedophiles and save everyone the problem?
Exactly, like that bloke that got, who was it? That childcare worker. Yeah. All the articles were like, he's going to be isolated because if they put him with everyone else, he's going to die. So he fucking should.
Right. Need to stop protecting these people. Like, if it's some poor bloke that's hooked up with a girl at a nightclub and thought she was 19 years old and it turns out she's 15, okay, protect him. That was a fucking whoopsie. Like, if she was in the nightclub, he should be able to assume that she's 18,
old
whatever,
enough to be in a club.
But if you're doing stuff to children, to toddlers,
where they're going thinking they're safe, as a worker,
open the door, push them straight into fucking general population.
They'll get told anyway. I'm not
exactly. Tattoo fucking pedo across their forehead and chuck them into general population. I'll even do the tattoos for free.
I was saying, we've had so many crazy people get found guilty lately.
What's going on at the moment?
I think it's good though.
Yeah, except for fucking Diddy.
Yeah, what the fuck?
I feel sometimes we can just be like, here's a case and here's us talking shit. We need to put a disclaimer, be like, right, from here forward, we're talking shit. So if you don't want to
10 minutes, it's the episode.
For the first 10 and the last 10, you get nothing but shit.
But yeah, mental health is a bit of a lot of people have a lot of mental health issues at the moment.
Yeah.
I think going through COVID, going through pandemics and almost World War III's and financial crisis, housing are going to have mental health problems. People are going to be depressed. I'm not saying inevitable is the right word, but there is a lot of people that would be lobotomized if we lived in the 30s.
Oh yeah.
Through what we've all gone through.
I joke about it saying I would have been, but I would have been. Like, I'm opinionated, I'm loudmouthed, I'm depressed.
Very independent.
Yeah, I have BPD. I have moments where I'm that miserable that I can't function. I can't get out of bed. I don't want to shower. I absolutely would have been lobotomized. Mm-hmm. And then I go from days like that to, hey, I'm perfectly fine and everything's great and I'm going to take on the world. No, it doesn't matter what happens. Everything's a joke. And they would have been like, no, that's not normal. Here, cop this ice pick in the eyeball.
Nowadays it's like, that's every day.
Now you just go, yeah, that's Jade.
Welcome to adulthood. We love life.
It was funny, like totally off subject, but I had a client in the other day and we're talking about a concert because we went to the concert together last year. And they're coming back this year. And we're making jokes about how last year I forgot to get a ticket. But she knew that I would fuck up and forget to get a ticket. So she brought me a ticket. Oh, so the night before, she goes, are you going? I'm like, no, I'm not going. I forgot to get my ticket. She's like, I knew you would. So I got you a ticket. We were talking. She was in the other day and she's like, I'm getting your ticket. Don't worry. She's like, don't you do it because you'll forget. She's like, I'll just get your ticket. So like, how lucky am I that I live in a world where people just accept
you for you?
Yeah.
I love that.
Accept my Jadeisms, my Jadeness. And they're just like, yeah, that's Jade.
We know you for you and love you for you.
Suckers. Maybe you're the ones that need to be lobotomized.
You're just normal.
Yeah, I can't help any of this. You all choose to be part of my life.
We love you.
Thanks.
Well, so that is the lobotomy.
Yeah.
What a fucked up thing.
Right? And we've definitely noticed you guys commenting on stuff lately.
Yes, we are going to start commenting back because we've kind of...
We don't get notifications.
Yeah, that frustrates me.
Yeah. So, like, the only time we've seen your comments is if we've actually gone back into our old episodes and then we can see them there. So I've started trying to go through and see them and respond to people. And I made a TikTok. I made 2 TikToks.
I did see that. And also what the?
Right? When I was sitting there before thinking there's got to be a jade thing that happened. That was what I was thinking of.
Yeah.
The fuck? If
Go
you
check
haven't
it
seen
out.
it yet,
Yeah.
go look at the TikTok. Because you guys might remember a few weeks ago when we did the Bertha Shippen case that I went to go see her grave. And I mentioned how I recorded it and I played the little snippet on here. And when I was making the TikTok video, I'd made the video, cut it, edited it, took me fucking hours to get the right section of it, uploaded it. And as it was uploading and playing the video, I noticed the flash through it. And I was like, hey.
Wait a minute.
So I went and watched it again. And then I slowed it right down. And you can see it's a orb.
Yeah.
So it comes in and it comes as like a half an orb, like a half a moon, and then a full orb, and then a half an orb, and then it vanishes. And right as it does that, I think it's like a second or so before she answers me, where she says love, like when I'm talking about her.
The very first time she answered.
And it's funny because that answer, like when you listen to the other episode, of all the answers that I got that day, it was when she said love that I felt like I was actually talking to her.
And that actually gave me chills when I seen that.
Yeah.
Because I was watching it because all you can see the dirt kind of looks like a photo because nothing's moving.
Yeah.
But then you see that just flash past.
It's just a flash. It's very obvious, but it's there. But in slow-mo, you can see the shapes of it and you can see that it's an orb. And I think just the timing of it as well was just...
when those things were spoken.
It was insane.
That was a nice little video.
Yeah, I was very excited. So yeah, try and follow us on there. Do all the things, hit the bells, do the likes, do the follows.
Yes.
We're trying, guys.
As Jade was saying, hit that little bell. But,
that's it.
Yeah, thanks for listening to
Boo You Go on the Lobotomy.
On the Lobotomy, which we both need. I was going to say, what are we going to do on the next one? But I have no idea.
I've got a couple halfway done.
I've got a whole bunch of empty pages of just the title, but they're like things that I need to like research.
Nice. Nice.
Well, yeah, so we'll see you on the next one.
Bye.
Bye.